I'm Bob Beart. I'm the medical director of the Colorectal Surgery Institute at Glendale Memorial Hospital. We have become involved with and members of several large national trial groups where we bring new medications and surgical techniques to the patient that would otherwise be available only at the university. There's no reason these can't be done at the community level, and Glendale Memorial Hospital particularly has been very supportive with the research support and personnel to implement these programs. So we have new technology not available anywhere else in Southern California to evaluate blood supply of the bowel. We are also looking at new medications to not only treat colorectal cancer but also to prevent its recurrence. As the practice at the Colorectal Surgery Institute has grown, and it has grown rather rapidly, this has allowed us to bring new technologies. This includes things like manometry, where we can evaluate pelvic floor function and evaluate patients who have poor control of their bowels. Ultrasound, which allows us to evaluate cancers in greater detail, also allows us to evaluate the sphincter mechanisms in ways that have not been available before to the community. Third eye is a new commercially available technology. We actually can look in two directions at the same time. So when there's a fold in the colon, we can see both sides of the fold rather than just the front of the fold. And this allows one to pick up about 25% more polyps than you would see otherwise. The Institute has only members who are fully board trained and certified in colorectal surgery. So I think that's to the patient's advantage. I think secondly, because of the volume of work that we have and the technology we have available, we can bring things to the patient and the patient's care that are not available in many other environments. As a group, the physicians and surgeons at the Colorectal Surgery Institute have a long history together. We've all been teaching for over 15 years at the University of Southern California. Dr. Vukasin was actually a resident there when I first joined the faculty at the University of Southern California. And Dr. Garza was a resident there somewhat later. Both of them went through the colorectal surgery training program at USC, so we've known each other very well for a long period of time. I think it's important to emphasize that medicine is very multidisciplinary and complicated today. And if you're really going to take good care of patients today, you have to have multiple levels of support. In the area of communications with the patients and making sure that they have not only access to us, but we get the information that we need to them in a timely fashion. So if you're going to have a quality practice, you have to have those sort of things. And it's only through partnering with somebody like Glendale Memorial Hospital that we felt we were able to bring all those resources together, really to the patient's benefit.